Welcome to another in our series, Lessons from the Life Coach with iFoster, where we discuss tools to help empower you to take the next step in your mental health journey. In this module of the series, we will answer the question, what can therapy do for you? So, what will we cover today? In this section, we will discuss what a therapist does, their role and their function, the types of therapy available, what you can expect from a therapist. So let's dive in, shall we? So, when we say therapist, what do we mean? Therapists and mental health counselors are professionals who have received extensive training to hold individual and group counseling sessions. They hold at least a master's degree in psychology or counseling and have completed several years of clinical experience. Therapists must also pass a licensing exam in their state in order to practice. Therapists can typically diagnose and treat mental health conditions but cannot prescribe medications. Mental health professionals can offer advice, support, and a safe space to talk about the problems a person is struggling with. Therapists can understand their feelings, identify issues that affect mental health, discover ways to overcome those issues, learn new skills and coping strategies, set goals for personal growth, and learn more about mental health conditions. Therapists can also address specific conditions or situations and sometimes specialize in one area, including grief or loss, phobias, addiction, anger management, bereavement, eating disorders, relationship and family difficulties, or trauma. The term therapist is a very common one, but there are many types of professionals that can provide therapy to clients. Counselors often provide support that is more brief in duration and focused on a specific issue or solution. Clinical social workers and psychologists focus on more severe mental illness and long term treatment. Psychiatrists are trained medical doctors who can prescribe medications. Coaches focus on specific goals related to everyday life but do not typically address mental health or emotional distresses. For many people, what kind of therapist do I need is their first thought when looking into mental health care. Effective approaches to therapy are thought to share common factors, such as a therapist who treats the client with empathy, a rapport between the therapist and client, sometimes referred to as the therapeutic alliance, and agreement about goals of therapy. While most types of therapy have a lot in common, they also fall into clusters that share core features. Behavioral therapy helps clients learn and practice ways of dealing with negative and automatic thought patterns by challenging those thoughts that cause stress. Psychodynamic therapy focuses on the individual and examining inner conflicts that draw connections between current feelings and past experiences, identifying common patterns in thoughts, experiences, and relationships. Marriage and family therapy examines the behavior of two or more people and the relationships between them, while also sometimes addressing individual concerns separately. It is important to do some research and discuss with the professional to see what types work best for you. And all modalities of therapy can be delivered online or via telephone or in person by a skilled clinician. With very few exceptions, what you discuss in therapy is always confidential. Your therapist can't share information with anyone else without your written permission. There are a few specific and clear instances when therapists are required to report personal information about their clients. These include if the client poses a danger to themselves or others, if the therapist suspects the abuse of a child or an elderly person or otherwise dependent adult, if they are legally forced to by a court order. Mental health professionals are trained to understand beliefs, backgrounds, and values of their clients. This includes their culture, race, ethnicity, socioeconomic status, and sexuality. Therapy is a personal and intimate experience between you and your therapist. It's crucial for you to feel understood by your therapist and for your therapist to make efforts to understand you for therapy to be effective. It's okay to ask your therapist questions to make sure they are the right therapist for you. Ask your therapist if they are familiar with your culture, beliefs, and values, especially towards mental health, are willing to learn more about your culture, beliefs, and values, have experience treating people with your cultural background, have had cultural competence training, plan to include cultural aspects in therapy sessions and plans, or are bilingual or bidialectical. It may take time for you to find a therapist who best aligns with your goals, but the benefits of therapy can help you cope with the unhelpful thoughts or feelings you may be experiencing. Continue to learn with us through this series. In our next module, we will discuss the first steps in finding and meeting with a therapist.
If you're experiencing suicidal thoughts, help is immediately available. You can access free support right away with these resources. Dial the Suicide Crisis Lifeline. Call the Lifeline at 988 or text. There are English and Spanish operators available 24 hours a day, 7 days a week. Text HOME to the crisis text line by texting to 741741. For LGBTQIA+ youth, contact the Trevor Project. Text START to 678-678, online or chatting 24/7.